A very good morning to you. Do you think that's a key factor here? Are you seeing substandard quality getting to the areas that need it the most?
Good morning. Yes, I haven't really, I wouldn't say I've seen that substandard, but it's common knowledge that it's more difficult to get quality masks in poorer areas. People don't have the means. There's increase in poverty. So there's definitely more difficult to get a quality mask. They cost a little bit of money. And the Ubuntu Care initiative would like retailers to buy the quality masks, and for every pack they sell, they can distribute for free into the poorer areas.
Yeah, tell us a little bit more about them and how important it is to tackle this, because I guess when you're wearing a mask, even if it's bad quality, you have a false sense of safety.
Yes, I do think it's important to note that masks are only part of the solution. The most important components are still to not go into crowds, to avoid close contact with people, and to avoid closed environments. This is the 3 C's. So social distancing still remains very important, hand sanitizing very important, and then a third component is wearing masks. Wearing masks are particularly important when you cannot adhere to the other factors mentioned. So if you have to get into public transport, if you have to go to work where there's an open area, offices especially, and poor ventilation maybe, those are the special situations where you really need to wear your mask. If you go for a run outside, no need to wear your mask.
Oh, good. All right. Do you think that we are in the second wave? I mean, I was just talking a little bit earlier on that I went for a test yesterday. I went away to Cape Town this weekend, feeling a bit rough on Monday, so I thought I'd have the test. The test centre told me that the number of infections they've seen over the last week has more than quadrupled. Are we in it now?
Yes, I've heard reports, especially from the private sector, that there's increased numbers. We haven't seen it yet in the public sector, but it's inevitable. The rest of the world is seeing it. There's no reason why we should not be seeing it soon.
How do we keep our focus on the poorer communities, those who find it hard possibly to communicate, to get their needs out?
Yeah, it's difficult. As you know, in South Africa, we've had the problem of the poor socioeconomic situation for a long, long time. And I think NGOs, government needs to be aware of the increased risk of poorer communities. They often don't have the means to get into their own car, to go to work. They often don't have the means to actually say that I can't go to work because they may lose their work, because they may be in informal settlements. So these people have many, many, many challenges. And I think every citizen in the country should if they can, contribute in some way to alleviating the pressures and the stress on these communities.
What else have you learned that these communities can benefit from? The science behind the pandemic. So much has changed since it first hit us in March.
Well, that's a difficult one. The science has not really been focused on the poorer communities. That's the problem. We've seen from the little bit of science from the UK and the United States of America that poorer communities, marginalized communities, are at increased risk, not only for exposure, but also for more severe disease. In those environments, they've shown that people that are poor also don't have access to good food, maybe don't have access to knowledge in terms of healthy living. So I think going forward, more healthy living programs in those areas is something one can do to eliminate comorbidities more effectively, and to focus research in those areas to see how one can prevent comorbid disease and chronic diseases in those communities.
Jantjie Taljaard, good to talk to you. Thank you.